Hi, I'm Megan. We are excited to be here and share therapy with you guys that we're really passionate about. I started Inspire Speech and Feeding in 2019. My passion for feeding therapy came about after navigating pediatric feeding disorder with my own kids. And I wanted to be a support to families who were going through the same thing and traveling that road that can be really difficult. And we work with a lot of medically complex families, and we've been able to see how these therapies can really change the trajectory of their lives and their day to day. So yeah, we're happy to be here, and I'll let Katie introduce herself.
Hi, everyone. I'm Katie. I've been with Inspire working with Megan for about 4 or 5 years now. I did my undergrad at Clemson in health science and then went to USC for grad school. And I just love the Columbia area, so I never really left. We now live in Chapin with my husband and our 1.5-year-old daughter. I'm doing June with a little boy, so life's about to get very busy and a little wild, but super excited. And yeah, I'm just really excited to share some insights with you today from an SLP perspective, and I'm happy to be here. Next slide.
Okay, so we'll jump in. What is oral function therapy? So it's a combination of specialized interventions that focus on the muscles and movements of the face and mouth to optimize structure and function. So when you think of speech therapy, you probably think of language or maybe working with AAC to communicate. And this may not be something that you're familiar with, but think of physical therapy before the muscles of the face. So lips, cheeks, tongue, jaw. And that's our role as a speech pathologist. To work on these muscles. And when we talk about structure and function together, those things make up and guide orofacial development, which just means how the head and face develop. Some of the key factors that drive that are airway, tongue position, and palate shape. We'll speak to those a little more throughout the presentation. And if we could try to summarize this, then I think the best way is this little graphic to the right. This therapy is meant to maximize breathing, maximize feeding, and maximize oral movements. And those things together create optimal functioning and wellness as a whole. As a little disclaimer, we could probably talk for hours and hours on each of these topics individually. So we've tried to compact them into a summary and something that's really informative for families. If you want more detail, have questions after, we can also share our contact information as we dive into these a little bit more. So we can go ahead to the next slide. Perfect. So this graphic is meant to show that these therapies they're connected and overlapping. It's difficult to break them apart, which we are going to try and do for you and explain each one and what the purpose is, but they really all work together and they need to be done together in order for it to be successful. So we think of that sensory motor as the thing that drives all of the therapy. We come into every evaluation assessment plan of care looking at the whole child, that holistic myofunctional therapy piece. And we use oral motor exercises and feeding therapies all as a part of this overall oral function work. So now we will go into each of those separately, but just remembering that this is all one and all work together. So Katie's going to talk about sensory motor.
Okay, so that first section of the oral function therapy includes sensory motor therapy. And basically, what this is it's preparing the mouth. So, the purpose of this is it prepares your child's mouth and brain for eating by organizing sensory input, supporting muscle coordination, and guiding mouth movements. And so, what this kind of looks like is gentle, systematic input to the face and mouth using touch, vibration, or temperature. And so, what we really want to do is individualize each plan of care to each child's needs and preferences. So some children might like deep pressure, while others might like vibration, and so we really try to distinguish which is going to be the best for each child. And we'll look at more. So for vibration, we use tools like a Z-Vibe, which we'll talk a little bit more about later. So what this does is it creates oral awareness, activates muscles, and guides oral movements. Therapists may use fingers or tools for massage, stretching, and cueing with support during eating. And then approaches may include oral placement therapy, which basically it uses a combination of auditory, visual, and tactile stimuli to the mouth. And once again, this is super individualized to support each child's needs and preferences. So some benefits of the sensory motor therapy is that it calms sensitive mouths, improves readiness for meals, supports motor planning, makes eating more predictable, and builds a foundation for chewing and moving food in the mouth. So next, we can go ahead to the next slide. And we'll dive more into the oral motor part of oral function therapy, which is stretching and strengthening the muscles. So the purpose of oral motor therapy is that it uses neuromuscular exercises to strengthen and coordinate muscles through targeting strength, endurance, and stability. And this allows for a safer, more efficient feeding and swallowing. So what this is going to look like kind of is that it's therapist-led stretching and assisted movements. So exercises are super repetitive but playful and fun. And then a main factor of this is that we want lots of parent coaching. So we like to go through each exercise and provide videos on how to properly perform each stretch or exercise. So parents feel super confident and they're able to do these at home, and skills are generalized in that home environment. So approaches may include Beckman oral motor or GOMAP, which basically are super extensive, but they both provide lists of specific exercises and stretches that target specific areas to the face. Some benefits of oral motor therapy is that it reduces mealtime fatigue, improves swallowing control and chewing, increases strength and range of motion, and helps children manage and clear food more effectively. So Megan's going to talk more about the other two portions of oral function therapy next.
So I'm going to talk about myofunctional therapy. And this is all about training efficient patterns. So we break that word down. Myo means muscle, so muscle function. And myofunctional therapy treats what we call OMD, or orofacial myofunctional disorders. And that just means it's atypical patterns that involve the muscles of the face and mouth, and those interfere with normal growth and development and function. And when that happens, we can have impaired facial growth, speech and feeding, swallowing issues, respiratory issues, sleep apnea, behavior issues, just to name a few. And so, myofunctional therapy focuses on supporting airway and overall orofacial development through optimizing oral rest posture, through balancing those facial muscles and creating stability, helping muscles to work together. And when we refer to oral rest posture, that means a tongue up, so being able to elevate the tongue to the roof of the mouth, keep lips together, maximize nasal breathing for all of those overall health benefits and speech and feeding benefits. So the therapy involves changing those muscles and habits to improve breathing, speaking, and swallowing. And what that can look like is a combination of things, from breathing exercises to improve nasal breathing and respiratory control. And that, of course, involves appropriate and early referrals to other professionals. Always a team approach with these therapies. So, ENT, who specializes in airway and complex populations, an orthodontist who specializes in early intervention with a focus on airway and orofacial development. And that doesn't necessarily just mean orthodontics like braces. There are lots of things that can be done very non-invasive that help to guide growth very early on. And that's a whole topic in and of itself. So we're just throwing that little tidbit out there. But airway obstruction is a big deal. We know this is something that our Sanfilippo population is already predisposed to. That doesn't mean that there aren't things to help alleviate and improve function. And so airway obstruction is going to lead to poor nasal breathing, which leads to the palate collapse. If you remember back to that earlier slide, that decreases the airway space because the roof of the mouth and the nasal passages, okay, that's the same part of the face. So we get collapse and narrowing that can lead to open mouth posture and breathing, low and forward tongues. That means poor air filtering. So our kids who are already more prone to getting sick, who we really don't need to get a respiratory infection or any illness, on top of what they're already having to navigate and go through. And so when you're breathing through your mouth, you're not filtering out all those bacteria and germs. Then, of course, we have poor sleep when we have poor breathing, and you may get things like snoring and apneas, and then that can lead to hyperactivity and behavioral symptoms. So it's all connected. And that's one thing that we always come back to with these approaches as a whole is looking at the whole child, the whole picture, the whole body. All of these systems are connected, and you can't just pull out one little feeding piece or one little speech component. It really needs to be a whole picture. So some of the other things that you're going to see with myofunctional therapy is practicing that good tongue posture, lip closure, chewing patterns. And if you're familiar with this or you look into it more, you may see that, if you're going through a true intensive myofunctional program, then typically it's meant for 4 and older, following lots of complex directions, and going start to finish with habituating an optimal mouth and breathing posture. But OMDs are very prevalent in our medically complex populations, and that includes Sanfilippo. So how do we address that? We don't just ignore it because maybe they have some difficulties with following some of those directions, or they get to a stage where some of the more volitional or difficult movements they can't do on their own. We are still going to approach this therapy with the goal of myofunctional issues in mind, and maximize these body systems through multiple modalities, the things that we've been talking about and are going to continue to show you, and using that sensory motor approach to support overall oral functioning. And the benefits of myofunctional therapy approach, that it improves control of food in the mouth. It improves the swallowing pattern, supports a smoother, safer swallow for these kids. It supports breathing, so we can optimize breathing and health through helping families to get the right team together, get those early interventions so that we can maximize breathing and reduce the severity of some of these other symptoms that come along with the disease. We can go to the next slide. Feeding therapy. When we think of feeding therapy, really think about putting it all together. So the purpose of feeding therapy is to help children eat safely and to grow adequately. And this includes all of the sensory motor work that we've talked about already, the modalities that Katie went through, the myofunctional therapy. It's all a part of that, but it also includes working on positioning, posturing, anything adaptive that we need to put into place or help families to get the right equipment that they need. Sensory exploration with foods and systematic introduction to new foods, diet expansion, nutrition. We help to guide nutrition and make recommendations and look at where kids are nutritionally, what they need. Also, when we need to, getting a good nutritionist on board to work with hand in hand. It could be working with new textures, finding the textures in foods that work best for these kids, depending on their skills, the stage that they're in, adjusting foods and textures where we need to, helping parents to learn how to do those things, teaching about food presentation and mealtime strategies that make meal times more enjoyable and more successful. Working with different utensils and feeding equipment. We have so many different things. So we pull out all of the fun feeding games, spoons, forks. Just we have drawers and drawers full of all of the things to show families and to try and to really bring in that enjoyment piece to the eating experience. And again, supporting families through appropriate referrals and advocacy for medical management, and how that impacts therapy success overall, and just making sure that families have the right team to support optimal feeding and function for as long as possible. And so again, the benefits for feeding therapy, reducing that mealtime stress for families, for the patient, promoting safe and enjoyable eating, reducing those negative experiences like gagging, choking, aspiration, of course, pneumonia being a huge concern with this population. So reducing all of those things and maintaining the oral feeding for as long as possible. And it is possible. And if, we're not really going to speak a lot to tube feeding in this presentation, we're happy to answer questions about that. But, we are very familiar with walking through that with families and managing that and what families' goals are, whether that's maximizing oral feeding, weaning, and depending on where they are when we come on board. Yeah, so those are some of the pieces that go into a feeding therapy program.
Okay, so now that we've talked about the areas of oral function therapy, I'll be talking more about the supporting modalities and tools. So one thing that we like to incorporate is myofascial release, which is just gentle, sustained stretching to release facial tension, improve comfort and mobility, and support other types of therapies. Nasal hygiene is another supporting tool that we like to use. This supports nasal breathing by clearing those passages and reducing inflammation. We use tools like saline rinses or sprays, also nasal gel and nighttime nasal strips. So we provided some of our favorites here in the presentation. They're included. And then next is a Myomunchie, which is a small chewing device that strengthens jaw and facial muscles. And there's a picture of it to the right here. Um, it supports sleep and swallowing, and it can be used as early as 6 months. And then kinesio tape is also used sometimes, and it provides muscle support to reduce fatigue, enhance activation during movement, relax soft tissues, improve lymphatic flow, and support lip function and nighttime breathing. So an example of the kinesio tape would be the myotape, which there's a picture of it to the right. It goes around the child or adult's mouth during exercises or during sleep, to promote all of the benefits listed. And if we go to the next slide, we have some more supporting modalities that we'll talk about. So next is the expiratory muscle strength training. And so we use tools like the breather, which is pictured on the right, to strengthen breathing and swallowing muscles, improve cough, airway clearance, and swallow safety. So how this is done is we get the child to breathe in and out of the tool. And if you can see, there's a little dial on the tool that changes the resistance and makes it harder or easier depending on the skill or where the child's at. And so this is often recommended around ages 4 to 5, depending on the child's ability to follow directions. Tools we often use in therapy include the Z-Vibe or Sensi, chewing tools such as chewy tubes, and therapeutic utensils, cups, and straws, including adaptive and textured options from Arc Therapeutic. We listed the, I'm trying to see, okay. We provided the link, so when you have some time, look at it because there's so many different options depending on what you're looking for. They have it all. And so you can go ahead and go to the next slide and Megan will wrap everything up.
So some key takeaways, because I know we've put a lot into a few slides. Early intervention is key whenever possible. So the earlier that these interventions can start, the better the outcome. So, don't wait until an issue arises with speech or swallowing. As soon as families get that diagnosis, we would love to advocate that they get a therapist who can implement these modalities, and work on oral function as a whole from the beginning. And again, multiple therapy types, all of it working together to support oral function and eating. Therapy, it doesn't stop or change the progression of Sanfilippo, but it does, and it will help them to enjoy meals for longer, and not just meals. There are a lot of global benefits, some that we've mentioned already. Family involvement is essential. Katie talked a little about parent coaching, and that goes for all of this throughout the whole process. Parents are involved, families, caregivers, part of the therapy, learning how to do these things and implementing them at home, because that's where the change happens, and helping families to have the most stress-free meal times and just the most health for their child is what we're here for. So swallowing and feeding, we know these change over time in Sanfilippo, and so this therapy is going to evolve as the child's needs evolve and change. So some of those things, again, that feeding, oral function therapy can do: support safe eating, okay? Keeping these kids safe, reducing choking and risk and stress, helping to maintain function for longer, reducing any maladaptive, those bad habits, those motor plans and patterns that begin even before you're seeing an issue with speech, feeding, and swallowing, getting ahead of that. So therapy reduces medical complications, which is huge. Less aspiration, pneumonia, fewer emergencies around feeding, and just better overall comfort. Therapy, again, supports families through a changing journey. It's a huge part of it. It's not just about being in a session with a child and doing a stretch or doing one of these exercises. It's about supporting these families and walking through, making sure the best team possible is in place, and that we are guiding development from the beginning as best as we can to maximize all of these skills for these children. And we can go to the next slide. We have a few more takeaways. And again, just want to reiterate here not just the importance of early therapy, but continued therapy, especially with our Sanfilippo kids, continuing these exercises and therapies at home, for the long term, because these strategies are going to help at every meal. You're going to help prepare the mouth, prepare the child for eating, and all of the other things that that we've gone over. And because of the changes that happen in Sanfilippo, we can't permanently retrain a muscle, um, but that doesn't mean that these modalities can't make huge and significant improvements, life-changing improvements. So early therapy equals longer periods of safe and comfortable oral feeding. And when they're done correctly, systematically, and consistently, then oral function therapy, it builds muscle memory. And this is a key thing with Sanfilippo, and an exciting point that this is all about procedural memory, and procedural memory learned routines. Those are often preserved longer in Sanfilippo. So these are repetitive in nature. You can embed them into routines, and all of the things that we've been talking about in these overarching therapies, that's the root of it. So it is directly related and connected with procedural memory, and we know that that's something that lasts longer. And some other functions that are preserved longer: receptive language. So children may understand more than they can express for a longer period of time. And so we can utilize that using simple, consistent verbal cueing gestures. Again, that repetition, emotional responsiveness, and social engagement. So they can respond to facial expressions, tone, touch, even when verbal skills decline. So using that positive reinforcement, that caregiver involvement, and bringing in that social aspect and enjoyment to the meal times and to all of these exercises throughout daily routines. And then sensory awareness. So the sensory processing may also be intact for longer. And this is why those sensory motor therapies are important and effective, even in the later stages, because some of these key areas do remain preserved for longer. And when families are coached well and they have the support that they need, and these things are a part of their daily lives and they are continued, then we can preserve these functions for much longer than would be without. Then we can go to the next slide.
Okay, so some tips for families. Um, we really want to integrate stretching and exercises into daily routines. So an example of this would be cheek stretches before snack. So those familiar cues build procedural memory, what Megan talked about in a little bit before this. And this makes them more automatic and becomes more second nature. Another thing that can be used is songs, clapping, and rhythm. And this reinforces movement patterns through repetition. We want to create short, consistent warm-up routines before meals, always in the same order to build coordination and sensory readiness. And then we want to make sure we keep mealtime super predictable with the same daily sequence, allowing safe oral movements to happen naturally without repeated verbal instruction. And so an example of this would be every single mealtime, you're going to wash your hands and then you're going to sit at the table, utensils ready, first bite, drink, and then social praise and social interaction. And so that routine really helps these children. Okay, we can go ahead to the next one. And these are just some resources and references. some helpful research, and then the presentation resources listed.
All right, and that is your last slide. So I will go ahead and stop the sharing and then we can get to some of the questions we got. So for our first question, when we have talked about therapies before, of course, there are modalities out there, there are therapists out there that have a way to find them easier. You can search for them online, you can find the license. Is there a specific certification or licensure that you would need as a speech therapist to provide these kind of therapies? And how can we find a therapist that does this?
So you definitely want to make sure that your therapist has postgraduate specialization in feeding, and not just feeding, but in these specific therapies. So you can look on websites like the IAOM, International Association of Orofacial Myology, to see therapists in your area who have a certification. And it's not necessarily that has to be the certification in order to use some of these principles. But if you're looking for someone who has done the coursework, done the certification tracks, the board certifications, um, but otherwise, Katie, do you have any, if you have any input you can jump into? Because I feel like this is something that we're always advocating for, to like get the word out. And there's not
I know,
one
honestly,
place.
I feel
Yeah.
like, yeah, honestly, I feel like there's not that many that specialize in this. Es- uh, I mean, especially in the Columbia area, more and more people are starting to learn about it, I feel like, but unfortunately, I feel like especially in the rural areas, it's going to be harder to find someone qualified. Um, I don't
But
know.
I think being, like having the information and knowing what to ask, like asking the therapist specific questions, like, do you use these therapies and modalities? What what specializations do you have, or certifications do you hold? And like, what courses have you taken, even things like that. And then networking too. So um, if in this population, for example, we're talking now, and if this is something that a family is hearing and they're like, oh, I want to find someone, near me, then, reach out to us. We can certainly use our network to try and find someone nearby who can implement, some, if not all, of these things. Um, but typically, it's going to be a certified speech pathologist. And some locations, occupational therapists do a lot more feeding than they do in our area where we are, Lexington, Columbia area. Um, More of our OTs are working on like just the sensory side of feeding, so tolerating different textures and things. Not necessarily our OTs at Inspire do a lot more than that, but it would be within their scope of practice if they had the appropriate training. But again, just because it's in your scope, you want to make sure that after grad school, this therapist has done the work to truly specialize in the area of swallowing, as it's complex, and it's a big deal. You're working, helping children to eat, and not only that, but to eat safely. So we're talking about aspiration risk and avoiding that and helping families to navigate very complex situations. And so just ask all the questions. Don't be afraid to be that person. Unfortunately, I don't know that you'll be able to just Google search and find the right person, but hopefully if they do work in these areas, that may even be something that you can do. Use these keywords that you have in this presentation, look at their websites, look at their information, search and see what they're saying, what they have listed, and
Right.
ask those questions.
So, is the governing organization?
Oops, sorry, it broke up a little bit and I couldn't hear the first part of the question.
You said that the IAOM is like the governing organization.
So they are, that is one organization, or that's the board certification track for orofacial myology specifically. Our board for speech in general is different. That's called ASHA. But through the IAOM, or something called the QOM, so there's QM, and then my credentials are the COM, and those are things families can look up as well. And those, if you go to those websites, then they have directories. So that's where you might be able to find a myofunctional, someone who's taken the coursework or who has the certification. And then other than that, there's not like a specific directory or place to go to see, a therapist who specializes in all of these things, except for actually, let me think real quick. It is,
I want to reassure anyone watching that there's a lot of acronyms here. And
yes,
as we all know, in the world of special healthcare needs, we get a lot of acronyms thrown at us. All of these will be written out. We'll get at the links and we'll provide them to you with the recording after we finish. Don't worry.
yes, there's so many acronyms. So feeding matters. If I'm not sure if that's something that families are already familiar with, but it's an excellent organization, and they also have a directory. Now, that would mean that the therapist or the practice would have had to go on and put their information there, but that is another really helpful organization, and they have lots of resources for families as well. Maybe not specific to Sanfilippo, but it is good. But any way that we can help to connect families to therapists, we will.
You for sharing that. It's definitely helpful as we know it is hard to find people who have Sanfilippo experience, let alone expertise. So we always appreciate, sharing those kind of governing bodies or organizations that we can even just ask the questions to.
Mhm.
So I really appreciate you sharing that. Another question we have, I know you briefly mentioned feeding tubes, and that is a big topic. They come with a lot of questions. So and I don't want to open up a can of worms to a
Yeah.
longer conversation,
Yes.
but in your opinion, in your experience, what kind of cases are there where it's still possible to eat by mouth or eat by mouth for pleasure when you have a feeding tube? Does that happen?
Oh, yeah, absolutely. We have quite a few kids on our caseload. I have one little guy. He's not a Sanfilippo case, but has very medically complex issues from birth. A lot of them involved in similar ways, cognitively to Sanfilippo. And when I started working with him, he was fully, all nutrition by tube. And we have done all of the work that we've talked about in this presentation. everything adapted to meet him where he is at his skill level, because he's, he has to have all of the adaptive equipment to sit. He's not standing, walking, or anything. So we have a lot of things going on. And we've worked for, goodness, it might be going on 2 years now, but he's down to 2 tube feeds a day, and he's eating chewable food. So most of his nutrition is by mouth now. And it's very possible. Again, Katie talked a lot about individualizing to the situation, the child, family's needs, what's going on. Every case is different, but it is 100% possible to have some level of oral feeding exposure, whether that is to supply part of or most of the nutrition, or for pleasure feeds. And again, if the earlier that these therapies can start, the better. The better the outcome as far as long-term feeding continuing, and then continuing to implement these strategies. So it's not like, okay, I hurt my leg, I go to physical therapy, I recover, and I'm good. It's continuing all of these things to keep that muscle memory going, and to keep those connections happening, in order to continue with feeding. And and if it gets to the stage that we need to modify texture, diet, tools in order to maintain some kind of oral feeding, then that's what we do from there. So we really try to make it about the family's goals too, while also coaching them through what's going on individually in their child's case, and appropriate expectations. But again, I can't think of one case where we've walked in and said, this is the way it is, and we're just going to help you learn how to use this enteral feeding system. Like, we're going to do everything that we can, and we've seen these therapies work too many times not to implement them.
Awesome. That's great to hear. And one question I think I actually have for you, Katie, we touched a little bit on those tools. Is that something that the therapist provides or the family would need to get and have on hand?
So, our clinic has all of the tools that we talked about. And then we also, depending on the situation, we can rent out at our clinic. We can rent out the tools to families, and so that they can have them for a while, see if they like them, and then maybe purchase them if they work for the child. So you don't want to, I feel like it would be best for the therapist to provide the tools for a while, because there's so many choices, and you want to figure out what works best for your kid. Instead of blindly just going in and trying to purchase random ones that might not work and you lose a bunch of money. So it would be better to test them out, and then you can kind of purchase from there.
Good to know.
Yeah, and
Definitely like to save where we can.
yeah, well, thankfully, a lot of the things that we recommend aren't super expensive, and when we can, we try to come up with ways to utilize things that are very inexpensive that get the same outcome. So we're pretty good at that. And in at least where we are with Medicaid, sometimes with certain programs, or like a medical children's waiver, there are situations, just like with bigger equipment and getting that paid for. If you talk to your advocate, it may be something that they would potentially cover if your therapist said, okay, I recommend these tools and this is why. So that's always an option, at least something to ask about.
That's good to keep in mind. Are there any last thoughts? We don't have any more questions. Are there any last thoughts that you guys want to impart before we wrap up?
Do you have anything, Katie?
I think we wrapped it all up.
Yeah, I think you guys did a great job covering this. I learned a lot. A lot of this I definitely didn't know. It was very thorough. Loved the pictures. If you would like to share your story or your child with Sanfilippo on our website, or become a partner family with our foundation, we also would love to speak with you and learn more about your child. You can reach out to us at, again, contact@curesanfilippo.org, and I will share that along with this post. So thank you again, Megan and Katie. This was incredible. And I look forward to, helping facilitate some connections for other families and children for this kind of therapy. So thank you guys again, and I hope everyone has a wonderful day. Bye.
Thank you.
Thank you so much.